At 5:30, and we begin with President Trump's latest sweeping executive order aimed at lowering prescription drug prices.
It sets a deadline for drug makers to lower the cost of prescription drugs or have to face limits over what the government will pay. It's not clear what impact, if any at all, the executive order will have on people with private health insurance, but it could have a significant impact for people covered by Medicare and Medicaid. The president also didn't address what this could mean for tariffs that he has threatened to put on the pharmaceutical companies when it comes to drug imports.
News 4's Rana Novini is live in our newsroom with more on that order and how the president says it should work. Rana?
Yeah, Adam and Gilma, prescription drug prices are notoriously high in the U.S. This executive order would align what the government pays for certain medications to the prices paid in other countries. The president saying that could reduce drug prices by 59%. But critics wonder if it will withstand legal challenges and if patients will end up seeing the benefits.
Here is the bill. Bobby, come on over here.
President Trump says he wants to slash prescription drug prices, signing an executive order Monday, ordering the Department of Health and Human Services to negotiate prices with the drug industry. After 30 days, the U.S. would enforce what's called the most favored nation pricing model, capping U.S. prices at the lowest rates paid by other developed countries.
Whatever the lowest price paid for a drug in other developed countries, that is the price that Americans will pay.
We'll see. I hope so. I mean, it would be a good thing, right?
While similar efforts in the past, including in Trump's first term, have failed, people we spoke to in Midtown today say they're hopeful. Quasi Brown saying he hopes it lowers the cost of his parents' diabetes medication.
They find themselves kind of trying to budget and not taking their medicines like they should because of the prices. So yeah, it's definitely a burden.
Many of my patients who come to see me, even for simple infections, sometimes they call me back that the medication is too expensive. They ask me if I can change it to an alternative, a generic or something cheaper. So it is a problem for patients.
Dr. Michael Aziz is an attending physician at Lenox Hill Hospital. He says it's too soon to know how the executive order will affect prices for patients. And meanwhile, pharmaceutical companies are pushing back. The industry's biggest lobbying group saying importing foreign prices from socialist countries would be a bad deal for American patients and workers. It would mean less treatments and cures and would jeopardize the hundreds of billions our member companies are planning to invest in America, threatening jobs, hurting our economy, and making us more reliant on China for innovative medicines.
Now, the Trump administration has not said which drugs would be singled out for cuts, but notably here, the White House saying it would not be limited to certain drugs under Medicare. It would also target medications covered by private insurance. Reporting live in the newsroom, Rana Novini, News 4 New York.